still here, and we thank you for your attendance. We have a special guest joining us. Before I introduce Laura Ryan, I'd like to introduce our professional team. So I think everyone knows I'm Lori Widener, your executive director. Derek Van Spoor is our associate director. Alyssa Brady is our project coordinator. And Jacob Knupp is our membership coordinator. Team, can we mute folks as they come in? Thank you. So what I'd like to do is start by introducing Laura. She's a new face for us. I've had the privilege of working with Laura since she transitioned over into her new role at HCA. So Laura has worked in healthcare for about 20 years, and most of her professional life has been involved in working with Medicare, whether it be as in medical claims or in system programming, benefit administration, and benefit counseling. She came to HCA in 2016 and worked as a PEBB customer service and enrollment specialist for a number of years. Most recently, she worked at Sheba out of the Office of the Insurance Commissioner, mentoring Sheba volunteers, and we have some Sheba volunteers with us, counseling Medicare beneficiaries on the complexities of the program, and handling escalated Medicare-related issues. So she clearly is very well skilled for her new role. She returned to HCA as the PEBB Retiree Benefits Manager this last September, prior to Ellen Wolfhagen's retirement at the end of 2024. So Laura, thank you again for joining us. Laura is going to be managing her own slides today. We would like you to put your questions in chat. Derek, would you like to walk our attendees through how to best do that?
Sure. Good morning, everybody. So as Lori said, we're going to ask that you place your questions in chat. Laura's going to have several sections as she goes through. As she ends each section, we'll address, take a few minutes to address some questions in the chat. On the bottom of your screen, you'll see a chat button that'll open up a chat window. And just go ahead and type your questions into that, and we will address them. Try to keep them on topic as to what Laura is speaking of. And if they're of a different topic, hold that question if you can. It may be answered further in the presentation, or if not, we can address it at the end of the overall presentation.
So I thank you, Derek, so much. I want to share with everyone that we've launched, as of today, a special landing page that not only includes resources for you on PEBB open enrollment, but also the broader Medicare open enrollment. So that page will be live, and you can read more about that in your news flash that you'll be getting today. I will let you know that Laura was kind enough to give us her PowerPoint presentation. And so you don't necessarily have to take copious notes because she provided that to us, and we'll make that available on that landing page that I just referenced. Okay, take it away, Laura. Thank you.
Thank you so much, Lori. Good morning, everyone. It's great to be here. Thanks for inviting me today. I'll also say, in addition to what Lori was saying, I'm not sure what all the resources that you'll have. This is my first group of the open enrollment season for these types of presentations. So some of the topics that we're going to be discussing today, we don't have them published on our website yet at HCA. They are going to go live in a week, so they'll be up on Friday. So you can certainly use this presentation as a reference, and then as you're looking for more details, just know you're getting an exclusive sneak peek, I guess, and all of our materials will be available for you in 1 week for more detail. All right, so let's jump right in. So thank you for that introduction, Lori. I am so happy to know there's some Sheba folks here. That program is near and dear to my heart. Such a great program. All right, so let's just take a quick look at our agenda for today. So first, we're just going to go over the relationship between Medicare and PEBB. We'll talk about the PEB Medicare plan types, look at how they interact with Medicare and each other. We'll do a little bit of an overview on Medicare Part D, and then specifically how that relates to the Part Ds that are now embedded in the PEB plans. We will look at the retiree premiums for next year. And then we'll talk a little bit about the PEB program for non-Medicare retirees. So if you're a retiree who's not yet Medicare eligible, or you have a family member who's not there yet, we'll discuss that a little bit, as well as split accounts. Split accounts meaning the situation I just described, where you have some folks on Medicare and some not. Talk a little bit about why to choose PEB. And then, of course, the upcoming open enrollment dates and rules and all that. And then I'll pause, as we discussed, I'll pause a little bit as we go where it makes sense to see if there's any relevant questions. And then we should have some time at the end too, if you would like to save your question for the end. I won't be able to see the chat, so I'll kind of be relying on Derek and Lori and whoever else is manning that to flag me if there's anything in there. Okay, so let's start with Medicare and PEB, and this is probably familiar to most of you. But once a person becomes eligible for Medicare, it is a requirement that you enroll in Part A and B in order to be enrolled in the PEB Medicare program. Now, you can be a PEB retiree without Medicare, that's fine, but you do have to enroll in Medicare as soon as you become eligible. Eligibility is based on age or disability status, so you may age into it. And so HCA, we offer a couple different types of Medicare plan types, and they are going to work differently with Medicare depending on which plan you choose. And we're going to go over that in more detail as we go along. And then as far as premiums, so you do pay a premium for Medicare Part B. That premium is paid directly to Medicare. That is separate from your HCA premium. Medicare, CMS, they set those premiums every year. It's typically early October. We don't have the numbers yet, but those should be coming out in the coming weeks. For context, this year in 2025, the Part B premium was $185, and the annual deductible is $257. So we're looking at probably that ballpark for 2026 as well. And then some members may be subject to an income-related monthly adjustment amount, or also called IRMA. And I'm going to talk a little bit about IRMA. So it is an additional monthly surcharge that some Medicare beneficiaries must pay on top of that standard Medicare premium. So this amount is determined by Social Security, and they base this on filed IRS tax returns for the 2 previous years. So what that might mean for new retirees is it's possible you could pay a temporary IRMA. So you may pay it in the beginning of your time as a retiree because it's looking back 2 years from when you were still working. And then it could drop off as you move along into retirement. So IRMA applies to the Part B of Medicare as well as Part D, and we're going to look at those tables briefly in a moment. One thing I would like to note is that we at HCA PEB, we do not have any access to IRMA data. So if you are paying an IRMA, this is not something we would know about or have any access to talk to you about. Because this happens totally on the Medicare Social Security level. So if you have questions or concerns, or you wish to appeal that IRMA amount, those are questions that have to go directly to Medicare. And that is something that Shiva may also be able to help you with too, or point you in the direction on how to do that. And so here are the IRMA brackets for 2025. Again, we do not have 2026 brackets yet, so these are for the current year. But just to kind of give you an example, if you're curious about it, it shows what the income range is for individuals, for couples, and then what your monthly premium for your Part B would be. So that 185 there is showing the premium that most people are paying. Yeah, I do see your hand up, Lori. Oh, you're still muted.
Maybe others see your screen. I do not see your screen. Does everyone see the
Oh,
screen?
is my
You
screen
do.
not?
You're seeing her
Yes,
screen?
I do.
Good.
Yes.
Okay, excellent.
Okay.
Okay.
Oh, you scared me for a minute. Okay. And so this is just the screenshot for this year for Part B. And next slide here, you should be seeing the Part D IRMA brackets, which are significantly lower. So this is something I wanted to bring up because with the majority of our plans seeing a change to a Part D pharmacy structure for 2025, some folks did notice that they had to pay this Part D IRMA, and this may have been new to them. So I wanted to just bring this to your attention that if you are wondering if you might have a slightly higher Medicare premium, it is likely due to the Part D IRMA. And if you really want to get into it, you can kind of sit and do the math. And mostly everyone I've spoken to who had concerns about this, when we kind of do the math, the premium savings far outweighs any IRMA cost. But it is kind of nice to see. Okay, so now I'll pause there for a second because next we're going to move into Medicare plan types. But are there any questions with what we've talked about so far? Okay, let's keep going. So in the PEB portfolio, we have 3 different Medicare plan types. The first is the coordination of benefits, or what we often refer to simply as COB. And this is a traditional Medicare fee-for-service plan. It pays primary on medical claims, or I'm sorry, Medicare pays primary for medical claims that are covered by Medicare, and then your COB plan is your secondary. An example of this plan, and we'll see this as we move on, is the Uniform Medical Plan. It also has the unique benefit of what we call the COB Savings Bank. And this savings bank can offset out-of-pocket costs that are paid for Medicare covered services. So you may receive reimbursement from your plan for out-of-pocket costs that you paid on Medicare covered services. The next plan type are Medicare Advantage. We hear a lot about these. The Medicare Advantage plans in the PEB portfolio, these are employer group waiver plans, Medicare Advantage plans. So these have been specifically negotiated for our program. These are not commercial plans. They can be HMO or PPO. And most of them, even in the commercial market, do include Part D. All of the Medicare Advantage plans in the PEB portfolio do include Medicare Part D for your pharmacy benefits. And then lastly, we have Medicare supplement plans. A supplement plan is designed to cover the services that Medicare covers. So Medicare covers a portion of the services. A Medicare supplement plan will cover the remainder after the annual deductible is met. A Medicare supplement plan does not pay for anything that Medicare does not already cover. So the biggest omission that we always like to make sure people are aware of is a Medicare supplement plan you'll need to purchase a standalone Part D plan from the commercial market because there would be no pharmacy coverage through these plans. And then we're going to kind of look at, okay, how do these match up with what you can get through PEP? So our coordination of benefits plan, COB plan, that is the UMP Classic Medicare with Part D. We have a few different Medicare Advantage plans. So those are the 2 Kaisers, the Kaiser Northwest and the Kaiser Washington. And then the 2 United Healthcare plans, which are the PEB Complete and the PEB Balance. And then for the Medicare supplement plans, we have the Premera Plan F. This is closed for new enrollment, still existing for those who've been enrolled in it prior to 2020, and the Plan G. Now, differences in how these plans work. So with the UMP Classic with Part D, the Coordination of Benefits Plan, as we discussed, so this is a full secondary to Medicare. And then it also includes additional benefits that are not covered by Medicare at all, in which case it is primary. So it is the most expensive plan in the portfolio, but it is a very rich plan. There's a lot of flexibility with this. This plan covers non-emergency services internationally. However, please note that it does not cover any Part D international services. But it covers your Part D as long as it's not international. And to be in this plan, you do need to have a permanent residency within the US or US territories. And then we have the Kaiser Medicare Advantage plans. These are all HMO plans. These are closed network plans. They are regional, so you do need to live within the plan's network. They have what we call a closed network. So there are limited exceptions for out-of-network services. So typically, if you are a Kaiser enrollee, you are going to see Kaiser doctors and go to Kaiser facilities. There may be instances where they refer you out to a non-Kaiser facility, but for the most part, you would be working with Kaiser. And these also include Part D pharmacy coverage. And lastly, we have the United Healthcare Medicare Advantage plans. So again, these are group Medicare Advantage PPO plans, which means that a member in these plans can see any provider who accepts Medicare and takes this plan. And there is no difference in the copay to a member if they see an in-network provider versus an out-of-network provider. This is a very stark difference between a United Healthcare group Medicare Advantage plan through PEBB and one that you might see on the commercial market. The reimbursement for Medicare covered services for which a provider will not bill United is limited to the Medicare allowed amount. So essentially what that means is if you use this plan at an out-of-network provider who won't bill Medicare or who won't bill United, and you pay for that up front and you submit reimbursement to United, you would be paid up to the Medicare allowed amount. And then reimbursement for non-Medicare services is 100% less the copay if there is a copay. These are nationwide plans, and they also provide non-emergency services internationally. These plans also do provide some prescription reimbursement for international claims. We haven't really seen much utilization with that, but if you were to fill a prescription outside of the United States, you could submit it for reimbursement. This year, I believe it's a $30 copay. So you'd pay the first $30, and then after that, you could submit for reimbursement on pharmacies. And then, of course, the Part D pharmacy is included in this plan as well. Oh, I'm sorry, we didn't talk about supplement plans yet. So this is the last one. So we've got the Plan F and the Plan G. And as we said, Plan F is closed for new enrollees as of 2020. And these plans are designed to cover the 20% copays that Medicare doesn't cover. The Part B deductible is paid by the member. So again, we don't have 2026 numbers, but that $257 is the annual deductible in 2025. These are nationwide plans. If you are in a Medicare supplement plan, as long as your provider accepts Medicare, you can use this plan. So it has a very flexible provider network. Really not a network at all. Just as long as they accept Medicare, they'll take this plan. These plans don't have drug coverage. So if you do take one of these plans, then you do need to make sure that you sign up for a commercial Part D. PEBB is a great resource for finding those. You can also go to medicare.gov. They have a very handy tool for helping you filter through and identify a Part D plan that is best for what you need. And then Part D, or I'm sorry, Premera does not offer any ancillary benefits within the plan, but they do have some discounts for gym memberships, hearing aids, and other things that are available to enrolled members. So if you're looking for some of those extra benefits, you could always start with Premera and see what they offer. Okay, and then we're going to just look at a little bit of some side-by-side benefit comparisons. So nationwide coverage, we see that with all the plans except for Kaiser, as we know that's regional. Medical deductibles, Kaiser does not have any, the other plans do. Pharmacy, this deductible applies to the UMP plan and the United plans, but not the Kaiser plans. And it is not applicable to Medicare supplement as they don't have pharmacy. And then for the hearing aids, glasses, contacts, massage therapy, you're going to find those benefits in all of our plans with the exception of Premera Plan G. Gym membership can be found in the Kaiser and United plans. And then, as we have mentioned, drug coverage is included in all of the plans except for the Plan G. All right, a few other comparisons, and I'll kind of let you look those over. You can see how the plans compare when paying for inpatient versus outpatient hospital care, as well as when you go to see your doctor or a specialist, urgent care, telemedicine. And sometimes if you're trying to decide if you want to make a change during open enrollment or if you're a new retiree and what you want to enroll in, these can be really helpful if you can assess what types of services that you most utilize. It's a good idea to take a look at these things so that you can find a plan that matches what you need. And then again, a few more comparisons looking at the hearing aids. We have hearing aid coverage through all of the plans with the exception of the Plan G. It's not a Medicare covered service, so it is not a Medicare supplement covered service. And then vision also is included in all of the plans with the exception of the Medicare supplement plan. And this will be a little bit important just to keep in your mind for later. Vision is included in all of the Medicare plans, with the exception of Premera. And before I move on to talking a little bit more about Part D, do we have any questions for this section?
We do, Laura.
Okay.
So Michael asked, can you clarify the definition of non-emergency medical services internationally? Historically, Uniform Classic, UMP Classic, would cover services such as hospitalization and acute care internationally through a global services contract.
Yeah, I wouldn't be able to get into specifics. If you are planning an international trip, what I would recommend doing is reach out to the plan. I am on the employee version of Regents, and I was traveling internationally and thought I might need medical care and realized that it would have been better if I had checked in with them before I took my trip. So if you are planning a trip, do check in so that you know what the process is. Typically, you will have to pay upfront, and it is a matter of submitting reimbursement. But there are different particulars each plan has for how and what you submit. So I would refer directly to the plan for more specifics on that question. And then if you run into issues working with the plan, certainly let us know. I'll have my contact at the end and we'll work with our accounts team for clarification. But I would defer that to the plan directly. there any other questions?
There is
Okay.
another question. Lynn, Lynn B.
Yeah,
We moved past the slide and I'm sorry. Could you frame your question for Laura?
yeah. Can you hear me?
Yes, you're a little echoey.
I know, because can you hear me now?
Yes.
Okay, hold on. I'm sorry, I'm echoey.
Oh, no, you're okay.
I have a. You guys talk about Medicare. I'm going to tell you, I'm on this phone for my mother, and I'm in healthcare, and I specialize in Medicare and all that. And I wanted to see because she was kind of uninformed from the year prior.
Oh, you're fading away a little bit there.
What?
Oh, you're very faded away. I'm sorry, I can't hear you.
Can you hear me?
Lori, I think you're talking to and you're muted.
Oh, sorry about that. Lynn, would you please put your question in chat, tease that out for us, and we'll come back to it. I'm looking to see. Christine, please put your question in chat. We've got lots of people on the call today, and it's just easier if we can read the question. That's why we went over how to put questions in chat. The more specific your questions, the better, so that, Laura will be able to field them. Okay, there's one other question here, Laura. I know it pertains to the question that I sent you last night from our healthcare work group. And I know you're going to cover that towards the end,
Yes.
about the Wiser pilot. So, that's all we've got for now. And we'll look for that more detailed question from Lynn.
Okay.
Okay. Okay, so there's a question from Ken. I don't see a reference to emergency room care, but something that looks like different terminology. Can you please clarify that? So that might be on your preceding slide.
Let's look here.
No. Go forward where you show the benefit. There you go.
Is this for the hospital? Oh, because we have urgent care and I don't have the ER in here. I don't have that comparison in here. I'm sorry.
Where would a person find that, Laura?
This will be on our comparison charts when they're published next week.
Great. And we'll have a link on our website to that. As Laura mentioned, we're her first presentation of the open enrollment season. And so we're her guinea pig. So thank you. That's a great question. And that information will be available soon.
Yeah. And thank you for that too, because that will help me probably adjust some of my information here.
Okay.
Okay. Should we move on?
I just have, one other question from Christine Clark, that she has a friend who is on Plan G who does not use the internet. If they have questions, would you refer them to Sheba? What would be your best recommendation there?
If the person is on Plan G and they don't want to change, I mean, as far as needing the internet for open enrollment, it will continue on. If they have specific questions about benefits, I would refer them to Primera directly because they are going to be the experts in how the plan is administered. But if they want to speak with someone at PEB, you can also give us a call, and I'll have the phone number at the end of this presentation for phone calls.
Thank you.
Okay, I'm going to go ahead and talk a little bit about Medicare Part D coverage. So we've talked about this pretty extensively, that all the PEB Medicare retiree plans do have Medicare Part D coverage for the pharmacy benefit, the exception being that Plan F and G. For people who live outside of the US or US territories, they are not eligible for Part D coverage. And really, that's a twofold because it's the same for Medicare. If you're enrolled in Medicare A and B, they want you to have a residential address in the United States or its territories. And lastly, you are not able to use manufacturer coupons with your Part D coverage. So for the Part D with PEB, there's options to pick up your prescriptions, get them at the pharmacy. You can also do mail order. One of the benefits with mail order is that you can get up to a 90-day supply. It's written a little funny here, but it's essentially you can get a 90-day supply for the cost of a 60-day supply. And the exception to that is specialty drugs, because specialty drugs are limited to 30-day supplies at a time. And then being part of a Part D means that you are also able to participate in the true out-of-pocket maximum, or TROOP. The TROOP is set by CMS Medicare annually as well. For 2026, that number is 2,100. So what that means for you is that you would not pay more than 2,100 in out-of-pocket costs for pharmacy prescription drugs. And you can also participate in the low income subsidy if you are eligible, sometimes called LIPS or LIS, also extra help. There's a few different names here. You would want to contact Social Security directly. It is a resource-based program, but if you are eligible, the program will pay for the drug premium portion of your premium, as well as out-of-pocket costs. There are some adjustments with where you fall in that program and what is covered, but it is a great program. And if you think you might be eligible, I would highly encourage you to apply. And then here I have a couple of the plans with the drug comparisons. So again, all Part Ds are going to follow that out-of-pocket max of the 2,100. And then some of these plans have deductibles. So for tiers 3, 4, and 5 with the UMP, there's a $100 deductible. No deductibles on Kaiser. And then 2, 3, and 4 tiers for both the United plans have a $100 deductible. And here on the next chart, now, of course, it's most helpful if you know what tier your drug is in, but this kind of gives you a good comparison of how much the maximum amount that you could pay in that tier for a drug. And then keep in mind that that doesn't mean, for instance, here with United Healthcare, that you're going to pay $5 for every generic. It just means you won't pay more than $5. You will pay the lesser. So sometimes, you'll have those prescriptions that are 43 cents because they're a tier 1 generic. You're not going to pay $41 or $5 for that drug once you've met your deductible. And that's all I have about Part D. So I'll pause again just to see if we've got any Part D questions before we move on. Okay.
Let me pick up some and team jump in as needed. There's a question from Brian. Does UMP have a dollar limit on hearing aids?
Yes, it is $3,000 per ear. And that's for every 36 months.
Okay. There's a question about, there's a broader question about the tariffs and impact that might have on pharmaceutical costs. Would you like to address that now, Laura? How will the cost of today's new pharmaceutical tariffs be handled, passed on to us, eaten by the plans, adjusted to formularies?
Yeah, I wouldn't be able to have a response to that, because that's our formularies are set and negotiated annually. So we've negotiated for the next plan year. So how that may or may not have an effect on the 2027, that's not something I know yet.
So the formulary information that was confirmed in August, that holds true for the plans beginning in January, on January 1st?
That's correct. Yep.
Okay, good.
And
We got that one answered.
Yeah, and I will say that plans do occasionally switch a drug's tier level. And there's a lot of kind of reasons that they may do that, it usually has to do with if something new has come on the market that may be more or less cost effective. So they are able to switch tiers mid-year, but the tier pricing is set for 2026. I have to remember what year we're in.
Wonderful. There's one more question. Can people on the Blue Cross supplement plan obtain a PEB Part D?
No, at this point, the answer is no. We don't have a PEB Part D standalone plan. So, it's not something that can be carved out of the other plans. So if you take that Primera Supplement Plan G, you do need to find a Part D commercial plan. There is not an opportunity through PEB to obtain that standalone.
Okay, our PEC professional team, are you seeing any other questions that I may have missed in chat? I think we may have gotten them. I think we've gotten them. Thank you.
Okay, sure. So we'll move on to the exciting what are 2026 premiums? Okay, so here we have the single subscriber premium for 2026. Let's see, I don't have a comparison right in front of me with last year's premiums. We've seen some go up, we've seen some go down. The really great takeaway here is if you're a UMP Classic Medicare with Part D member and you are planning to remain so, we've seen another nice decrease in those premiums. And then, well, I'll just kind of let folks look that over for a second before I move on to the next one. And then in the next slide here, this is going to show in bold to the far right, that is going to be the premium amount for 2 people, both of them being eligible for Medicare Part A and Part B. And we have a little bit of math here if you're interested in the details. So essentially what you're seeing is the premium amount for 1 person times 2, and then whatever that total is minus 575. That 575 is an administrative fee that applies to the plan premium, but you receive a discount if you have, you only pay 1 administrative fee per account. And sometimes we like to show this because sometimes people don't understand why it's not an exact one-to-one, why they're not paying the exact same price for 2 people that they paid for 1 person. That's because you do have a slight discount. Okay, and then, so these are the medical premiums. And then I also have the retiree dental premiums. The dental premiums are going to be the same whether you have Medicare or not. So you can see these are the same plans we've had, the Delta Care Managed Care, Willamette Managed Care, and then the Uniform Dental Plan. And I would like to say, because this is something we see happen every open enrollment, if you have Uniform Dental Plan and you want to keep it, and you're changing your medical plan, when you fill out your paperwork, make sure you keep the same dental plan because Delta Care also administers the Uniform Dental Plan. So sometimes there's some confusion with that. Okay, so that is my conclusion to the Medicare premium section. And I'm not sure if I'll pause here for a second before we move on to non-Medicare.
I'm not seeing any other questions in chat at this time.
Okay. I want to move on to briefly talk about the PEB retiree plans for non-Medicare members. So when you become a retiree, you're in PEB, regardless of Medicare eligibility. And I mention this because if you worked for a school district, you may have been in the SEB program as an employee. But once you retire, regardless of
You-
whether you have Medicare or not,
That's good.
you are in PEB.
The-
And the plan options that are available to non-Medicare PEB retirees are going to be the same that are available to PEB employees. So where you might see a difference is, again, if you're coming from the SEB program, you may not be as familiar with what is available to the PEB employees. And then vision plans. So there are standalone vision plans for non-Medicare eligible members. In 2025, the routine vision benefits were carved out of the medical plans. So this again only applies if you do not have Medicare. If you have Medicare, with the exception of that Premera Plan G, your plan already includes your vision benefits, and you cannot, nor do you need to sign up for a standalone vision plan. That's only for you. You don't have Medicare. And it's an optional election, just like the dental. So again, the vision coverage, it's carved out of the medical coverage for routine vision. And so there are 3 plans available: the Davis Vision, iMed, and MetLife Vision. And because we can't say it enough, again, these are not available for Medicare retirees. So even if you are a retiree in the Supplement Plan G, unfortunately, you cannot enroll in this. Although we know there's no routine coverage, vision coverage in that plan, these are still only plans for those who do not have Medicare. And vision coverage for medical conditions, that so examples would be eye disease, glaucoma, or cataracts. Those still remain under the medical portion of your coverage. And that also holds true for the Supplement Plan G. You do have medical condition vision coverage, but not the routine. And then you have hardware benefits in those plans that reset on odd years. And the core benefits are the same across all 3 of those plans. So you'll kind of have to look at them and see what works best for you, who your provider works with. And there's more specifics about those benefits that are on our website. And so again, what's on our website right now will be updated in about a week for 2026. And here are the vision premium amounts. And then again, a note that you don't want this if you already have Medicare. And then here are the premium amounts for a single subscriber. So these are single subscriber plan options. So you'll notice that some of these are going to look a little bit different than what those of you with Medicare have. And they are significantly higher when you don't have Medicare. And you may wonder, why are they so much higher? And that really comes down to the fact that as an employee, you have your employer contribution towards your medical benefits. That's funded by the legislature, and it creates those reductions in premiums for employees. And you no longer have that when you're no longer an employee. You also don't have access yet to the Medicare explicit subsidy, which is also funded by the legislature. And you may also be subject to some surcharges, tobacco use surcharge, spousal surcharge. Those do not apply once you become Medicare eligible. And so if you are a retiree who is not yet eligible for Medicare, or a prospective retiree, some of the alternatives that you might have if you don't want to take PEB retiree coverage yet is you can defer that coverage. There are very specific reasons that allow for deferral. The most common one that people may defer for is because they have a spouse who is still working and they can go on their spousal's employer coverage and probably save quite a bit of money. Another reason is you might find a plan on the health benefit exchange. That is a valid deferral reason. You could take a HBE plan until you become Medicare eligible and return to PEB. or you may choose a COBRA, depending on what your COBRA options are. Okay, and I'm gonna go right into split accounts and then I'll take a pause because this is still related. So split accounts, that's what we call an account where we have members where some may be on Medicare and some are not. So the premium rates are going to be a combination of the Medicare plan rate and the non-Medicare plan rate. And there's some internal restrictions with the program about which plans you can have if you are on a split account. So here is an example. If the person in Medicare is on the Northwest Senior Advantage, then anyone who's non-Medicare must take the Northwest Classic plan. And the prices I have here are for just subscriber and spouse. And then kind of looking at this list, if you are a Medicare member who's in the Washington Medicare Advantage plan, you have choices. So the non-Medicare members could be either on the Classic, the Value, or the Sound Choice. And they would have to choose one, and that one non-Medicare plan would apply to anyone on the account who is non-Medicare. With the UMP Classic, the UMP Classic Medicare plan, the choice will always be for non-Medicare members to be in the UMP Classic. And then for both of our United plans, because there is no corresponding non-Medicare United plan, the non-Medicare folks would be in the UMP Classic as well. Okay, so I'll stop there and see if there's any questions before we move on. We're kind of rounding down now.
Let's see. Matt asked the PEB Complete, which is a United Healthcare, premium rose much more than any of the others. Why?
Yeah, so it did raise higher. We were in negotiations this year. Part of that reason is because that plan grew quite a bit. The amount of people in the plan has gone up, and the amount of expensive services that have been accessed has gone up. And so that causes a rise in premiums.
All right. Mike asks, what is the date the premium price changes take effect?
January 1st.
Great. Let's see.
We have two questions that were asked earlier that I think we might have missed. One from Aruna, how does HMO or PPO plans work in PEB Medicare Advantage plans, or what are the differences in service?
Yeah, so in HMO, those are all the only HMOs we have are the Kaiser plans, the closed network plans. So HMOs typically have a very specific provider network. So with Kaiser, it has to be Kaiser facilities, Kaiser providers, unless Kaiser explicitly refers you to someone outside of that network. With the PPO, that you can typically see any provider you want with a PPO. So in the United PPO Medicare Advantage plans, you can see any provider as long as they are a provider who accepts Medicare. And if they will bill United Healthcare, so whether or not they're in or out of network, if they will bill United Healthcare, that's the easiest route. But if they'll still see you, but they won't bill United Healthcare, the members can pay out of pocket and then submit for reimbursement from United Healthcare. So HMO versus PPO, it's shows up a little bit in your provider flexibility.
And then this one, I'm not sure if we were going to maybe get into this later, so if we need to hold it, that's fine. But Elliot asked, Medicare has a trial program that requires prior authorization on 17 procedures. Will UMP have the same restrictions?
Yeah, I'll talk about that a little bit at the end.
Thank you.
Mhm.
Okay, let's see.
Sure.
I think that is everything, Derek. Did we get them all?
We're up to date.
Okay. All right, so I'm going to move into the last few topics that we have here. There we go. So why choose PEB? So this is a question that often comes up. And so a couple reasons why you may want to choose PEB versus commercial plan. PEB is an employer group, so it's a little bit like being part of a union. Washington State, for our healthcare benefits, combining the retirees and employees, we're the largest purchaser of healthcare in our state. So we do have that consolidated, it consolidates the market basket to drive negotiations for the best possible plans. So we do have a lot of negotiation power with the amount of members that we serve. And Part D in PEB plans usually have better benefits. So you are typically going to see lower copays, more robust formularies, so a lot more drugs included on the formulary. And oftentimes there will be additional over-the-counter products that you can also access with your Part D. Um, you also have PEB available to intervene when escalation is needed. I'm sure there are many of you on this call that we may have interacted with over the years. We typically will ask that you work with the plan directly first, but if you find yourself kind of in a loop where you're having difficulty getting to a resolution, then we want to hear about those because we have ways to intervene on your behalf or try to kind of drill down to what the issue is and what's going on. We have account managers for all of the accounts that we contract with. All of our account managers meet regularly with the plan, so we are in communication when issues come up. And then another really great benefit is that you can change your plan every year during open enrollment without restriction on switching between plans. A big one is Medicare supplement plans. Those who work in Sheba, I'm sure, are very familiar with Medicare supplement plans. Have a lot of rules in outside of this program where you can't just go in and out of them. You might be subject to medical exams, pre-existing condition, wait times. You don't have any of that in PEB. You can change every year. You could try every single plan if you really wanted to. No restrictions there. And then the PEB plans, they are richer and they do provide overall lower costs than what you're going to find on the commercial market. So every year, I know everyone will get inundated with all kinds of flyers and commercials about what's available commercially for Medicare. There's always going to be those very attractive looking $0 premium plans. But you know, the payment for those plans comes one way or another. So those plans tend to have very high out-of-pocket limits, more restricted formularies, and often more restricted provider networks. So, there's a pretty big difference between what you'll see in PEB and what you would see on the commercial market. I'm going to move now into talking briefly about open enrollment. Open enrollment is always going to start on the last Monday of October and end on the Monday before Thanksgiving. So for this year in 2025, that means that open enrollment is going to be October 27th through November 24th. And for that last date, November 24th, please know that we have to receive your forms by November 24th. So it does not mean postmarked. We have to have them received by November 24th. I highly encourage you, if you are planning to make changes during open enrollment, to do it in the beginning of open enrollment so it doesn't get away from you. And then also, I talked about this, but our website is going to be live on October 3rd, which is a week from today. that is where you are going to find information about our benefits fairs. So every year we host benefits fairs in several different cities across the state. So the cities and their schedules are going to be posted on our website, and you will also get that information in the October newsletter, which you'll be seeing shortly. The benefits fairs are open to everyone. So employees, retirees, SEB, PEB, anybody is welcome to attend and come and gather information. We will have presentations from the retiree plans that happen throughout the day. And then we always have the virtual benefits fairs as well that are available online 24/7. Outside of that, I have a page of resources for you. So again, I just said as of October, but it is October 3rd that this information is going to be available about those virtual benefits fairs, the retiree open enrollment page that will have a lot more information for you. And then, of course, all of the premiums. And then that question earlier about if you don't have internet access, we do have the PEB customer service number. Now the lines are open 8 through 4:30, and then you can also come into the lobby if you're local to the Olympia area. We take drop-ins, they're first come, first serve, but you can come in and speak to someone in the lobby. I think we're all aware that there can be very long hold times as we get into open enrollment. So again, if you have questions, please, the earlier the better, is always going to be the smoothest. And then we also have the Sheba contact there. So if you have Medicare related questions or are looking for some assistance with your Part D, that is where you would go. You can call Sheba, meaning the Part D if you have a supplement plan and you need to purchase a separate commercial Part D plan. And there we have reached the end. So I have a feeling there are probably some more questions. Before we dive into the extra questions, I do want to talk about the wiser model. So I know there has been a lot of interest and a few questions about this. And what I am talking about is a CMS announcement about what is called the WISER model. WISER, an acronym for Wasteful and Inappropriate Service Reduction Model. CMS is rolling this out to start at the beginning of 2026. This model aims to save money and crack down on wasteful and inappropriate spending, as they say. We are still gathering information about how this model may or may not affect PEB members. There are a few services that have been identified as they are going to pilot doing prior authorizations for these services. Some of these services are skin and tissue substitutes, electrical nerve stimulators, knee arthroscopy for knee osteoarthritis. Those are the three biggies. There's a list of about, I think, 8 to 10. I'm sorry, I don't have it up in front of me. So not all states are participating in this. Washington State has been identified as one of the states to participate by CMS. What this means possibly for you is that there may be some services that Medicare is going to ask for a pre-authorization before you have that service. Now, one of the kind of interesting things about this model is that it is still considered voluntary. So it could be that your provider does not choose to get a pre-authorization for that service and still orders it, and the service is still given. These claims will likely be adjudicated regardless of if the pre-auth is requested or not. And it could be that Medicare decides it was not necessary and wants to redact payment that they may have made. This is, I don't want to overcomplicate it because I think it's something that definitely feels concerning, but I do think that the reality of the impact is going to be fairly low. The responsibility is not going to rest on the beneficiary. So if you have a service that is performed and later Medicare doesn't want to pay for that service, that is something that will happen between Medicare and your provider. You will not be responsible for that service. Now, if you are in a Medicare Advantage plan, this model does not apply to Medicare Advantage plans. It is only for traditional Medicare. So if you are in that Medicare supplement plan, it is possible that this could affect you. But there is some precedence of Medicare requiring pre-authorizations for some services. The most prominent one is DME, or durable medical equipment. So if your doctor orders you maybe a specific type of wheelchair, or sometimes one that I used to see a lot in Sheba was a request for the chairs that will lift you up out of the chair. So your doctor may prescribe that, but Medicare may say they're not going to pay for it, or there's some other type of workaround. So it's not unprecedented for Medicare to require pre-authorizations. These specific services were chosen based on, I guess, utilization and how expensive they are and what the clinical outcomes of these services have shown to be. So if you're in that supplement plan, it's possible you may run into this. For the UMP plan, at this point, Regents is telling us that there shouldn't be any disruption to services. If Medicare doesn't cover it, then UMP will. So again, this is the information we have for now. We are anticipating low impact. As we know more, we will share it. So I'm going to pause there and see if there's any questions with what I've said so far.
There was one on this topic, and I believe you just answered it, but maybe you can clarify it for Elliot. Will Weiser apply to UMP?
Right. So we don't think so. And I'm not trying to be I just want to be clear that we're still trying to understand how this is going to work with our program. But at this point, Regents has told us that if Weiser applies, that then Regents is still going to pick up the service. So if Medicare says no, then Regents would still pick up the service. And again, as I know more, I will share that. I think this is a quick rollout, so a lot of the carriers are still kind of learning about it themselves and seeing how this may or may not affect the plan. But I will say again, it's traditional Medicare only. So if you're in the Medicare Advantage plans and this doesn't apply to you at all, and for the traditional Medicare plans, we're still working on how we might see this affect us.
And there was another one on this. How is the pre-authorization Weiser working out now in the Medicare Advantage plans?
So it's not something that Medicare is requiring of Medicare Advantage plans, because Medicare Advantage plans are privatized. They have a lot of these prior authorizations in place already to protect themselves from waste and inappropriate medical services being ordered. So all of these, when I spoke with United, I think all of these already exist in how United operates. And I mean, I can't speak to everyone, but I have not encountered issues with any of these things so far. If this is a service that your provider believes that you need, your provider should be making sure that they can give you that service. If issues arise, then we'll talk more about it. But I think at this point, we do expect low impact.
Okay. And so all the other questions are just miscellaneous. The first from Kathy. Last year, Kaiser increased the copay for Xarelto from $80 to $90, or from $80 for a 90-day supply to $200 for a 90-day supply. No notice was given to consumers or the pharmacists. Will this be more transparent for 2026? And how can a consumer see the co-pays for drugs for 2026?
Okay. Is it possible to compile some of these that are very specific? I might need to address a little
Yep,
bit later if I could get some of these
sure,
to
sure.
address individually. I'm not sure. I'm not sure yet what the costs are going to be for 2026 specifically. So if you're looking specifically for Xarelto, I'm not sure as far as when a drug changes tiering, which I think is what you're describing. Xarelto might have been in one tier and it was moved to another tier. There should be communication coming to you from the plan, letting you know your drug is moving tiers. And so if that didn't happen, I would like to know about it. So I would like to follow up on that one.
Okay. I noted that in the comments.
Thank you.
Okay. Aruna asks, when an employee separates before Medicare eligible age, what can a person do to make sure she can be in the PEB retiree health plan at 65?
hmm So if you separate before 65, there's a variety of rules. So it's a little bit specific to each individual as far as what DRS, Department of Retirement Systems plan you are in. So if you separate before 65, some of the plans require that you're drawing pension right away in order to defer. The best thing to do is you need to fill out deferral paperwork. That's super important. If you're not planning to enroll in PEB right away, make sure that you fill out your paperwork for deferral, because then you will receive a confirmation about whether you are able to defer or not. There are really specific reasons that allow you to defer. We talked a little bit about them. You can defer for COBRA. If you are able to get on your spouse's coverage, that's usually going to be a deferral reason. And HBE, the Health Benefit Exchange, if you take a plan through there. Typically, it would not work to take commercial plans. So if you separate service and then you buy a commercial plan, and then you come back when you're Medicare eligible, that's typically going to render you ineligible for PEB. So do fill out the paperwork, speak with us to make sure that you're doing all the right things so that you can return.
Great. Brian asks, with the United Healthcare plans, we can see an out-of-network provider if they accept Medicare. We are told that we can get a reimbursement if the provider does not bill United Healthcare directly. So are there really providers who accept Medicare but don't bill?
Yes, yes, there are. So there are providers who consider who have an agreement with United Healthcare to bill in network. And then there would be providers like any type of healthcare plan who may have no in-network agreement with the plan. Now, sometimes if they don't have the agreement, they will still agree to bill. And sometimes they won't, for whatever reason. If they might just say, you're not in network, I'm not going to bill. Um, the United plans through PEB are very robust and very different from a United Medicare Advantage plan that's available commercially. Um, so you have a lot of flexibility with the plan that you wouldn't have on the commercial market. If you see a provider who will not bill and you pay up front, there is a portal that you can access with United to submit for reimbursement. Excuse me. Um, and you can also call United Healthcare. The customer service can walk you through the portal. If you have any issues, please let me know.
Okay. Mike wants to know if I changed from UMP to United Healthcare and I find United Healthcare does not meet my needs. I hear that I can move back to my old plan if I make that decision between January 1 and March 30th. Is that correct?
That is half correct. um, I believe what you're saying is you left you left UMP for the PEB United plan. So as long as you're still within PEB, if you left PEB completely, you can't come back. But if you're still within PEB, you can go back to UMP, but that needs to happen during the PEB open enrollment, which is going to be the October 27th. Now all of a sudden I'm so many dates, October 27th through November 24th. That is when you have to make the switch. So the January through March, those dates sound like a Medicare enrollment date range that you might be referring to. But if this is all planned switching within PEB, it has to happen during PEB open enrollment.
Okay. Kathy asks, do you have any information about what's happening between United Healthcare and Overlake? She received a letter from United that her doctors and hospital will be removed from the plan on November 1st.
Yes. So what you're referring to is a network agreement between Overlake and United Healthcare. They are still in negotiations, but are required by CMS Medicare to send out those notices when the expiration is coming. So what we do see is those notices go out, and a lot of times the negotiations are resolved, and the notices do cause a little bit of distress. So, what I can tell you right now is that they're still negotiating. It's not done, but they are required to send out those notices. So stay tuned for more information on that. The negotiations are currently happening now. And we at PEB, we don't have any insight into the negotiations or influence. That happens between the providers and the healthcare plans. So we give you the information that we can or that we know, but we don't control that negotiation process. So yeah, what I can tell you now is that I know it's still ongoing. It's not finalized yet.
Okay. Brenda asks, can school retirees become part of PEB?
Yes. So if you were SEB and you are eligible, so there are eligibility criteria as far as your retirement plan. And then of course there are also timeliness. You have to submit paperwork within a certain time frame. But yep, SEB folks have the opportunity to join the PEB retiree program.
Okay. Runa asks, will benefits fairs have info about Medicare Supplement Plan G and 24-hour webinars?
Yes. So the 24-hour webinars, those are pre-recorded, and those are going to be up on the HCA website as of next Friday. If you are attending, I think what you're asking is, so if you're attending a benefits fair in person, or whether you're in person or you're talking about the virtual benefits fairs, there will be Plan G information.
Okay.
Would there be a presentation on Plan G also?
Yes, there will. If you're in person, they are planning to do a presentation, and we should have a virtual as well.
Thank you.
Okay. Sandra asks, do you have any information regarding coverage of weight loss drugs under the various plans?
I think that's what's probably things like Ozempic, Mounjaro. Medicare has not approved for the prescription of those. I'm blanking, GLP-1s, I think is what they're called, that class of drug. Medicare has not approved for that class of drug to be prescribed primarily as a weight loss drug. They won't pay for it. They'll only pay for it as a diabetic, under diabetic treatment. And so our plans follow suit. So they won't be covered primarily for reason of weight loss. They would only be covered by reason of diabetic insulin control. Thank you.
Um, okay, and the final one we have here is from Christine. For Part B nebulizer meds, Medicare requires a date of issue of the nebulizer equipment. How
This one might be something to send to me later because this is pretty specific. I believe nebulizers are typically covered as durable medical equipment under Medicare Part B. So maybe if I can follow up on that one. That one sounds pretty specific. I might have to do a little,
okay.
get a few more details there.
Yeah, we'll add that to our list for you for follow-up. Okay. That's all I have in the chat currently. Any other questions floating around out there for Laura? Not seeing any hands or any chats pop up.
Derek, would you like to take just a minute and talk to the attendees again about the special open enrollment landing page?
Yes, that was on my list here. First of all, we mentioned that Laura had this handout, and we are recording this, so both the recording and the slideshow that you see here will be on our open enrollment page. It launched last night. It is mentioned in our news flash today, but it's prominent on our website. And let me
Oh, sorry, I can take off my screen share if you want to put that up.
That's okay. So you can see it's prominent on our website, and this page has information both for PEBB provided health insurance and commercial market health insurance. And you will find Laura's presentation today right here. Here's her PowerPoint. And once we get the video uploaded, that'll be here as well. We have webinars from last year, as well as recent podcasts and podcasts from last year on Medicare. So we have a lot of information here on both videos and podcasts that we've done, as well as information on the plans. And then again, there's a section for non-PEBB Medicare enrollment with podcasts, videos, and additional information there. In addition to that page, we also have under our resources a healthcare resources page, which has a ton of information that our healthcare work group put together over this past year. So we have glossary of terms, a lot of questions with answers on there, links to our podcasts, videos, and webinars, links to SHIBA, traditional Medicare, Medicare Advantage, HCA, and PEBB, and then just some general links. So there's a lot of information there for you. They've done a tremendous amount of work pulling all that together for our members. So that is available on our website currently. And like I said, the video for this, once we get done here, probably later today, if not by Monday, will be uploaded onto the open enrollment page. I'll turn that back to you,
Derek,
Lori.
you have one question about access to the special page that we built for our members.
Oh,
And
I see
someone
that.
has asked whether someone who's visiting our website will have access to that special information.
The open enrollment page is available to just RPEC members. You have to be registered and logged in on the website to view the whole page. And that's real easy to to do as well. If you haven't registered on our website yet, go to the member area and select register new account. All you have to do is put your name and your email address in there. We'll verify you're a member and prove your membership, and then you can log in and see everything here. The healthcare resources page is open to the public.
Okay, thank you so much, Derek. Laura, you've done such an outstanding job for us today. Thank you for the detail that you shared and the resources and fielding all the questions. We deeply appreciate the partnership that we have with you and HCA.
Thank you so
And
much.
I'm
My
not
pleasure.
seeing anything else. Thank you all for coming today and for sticking with the presentation. And I know we hope that you'll visit that special webpage. And as Derek mentioned, it went live last night. You'll find the link in your news flash. So if we have an email on file for you, you will receive that as well. Okay, I think that's a wrap, people. Thank you so much.
It was excellent. Thank you very much.
Thank you
Thank
all.
you, Laura. Thank you, everyone.
Thank you so
Thank you.
much.
Have a good